Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back. If you're just joining us, we are talking about scars and wounds, and of course, here to answer our viewer questions is our favorite doctor, Express Care's Dr. Jitka Lom. Okay, Doc, let's get straight to our questions. Sherry from Jigo asks, is it true that vitamin E can help prevent a scar from happening if I put it on right when I get injured?
Actually not, Sherry. Vitamin E has been marketed but has really been studied, and it really does not make a whole lot of difference to your scar. So again, just wash your wound with soap and water, keep it clean and dry. Moisturizing may help it, so the vitamin E cream may be helping that way because you're moisturizing and putting your sunscreen on. But actually, the less you put on that thing, the better. Just leave it alone, allow your body to do its own healing.
Okay, Noelle from Dedido asks, I have dark skin and was wondering if I'm at a higher risk of developing keloids than others who have lighter skin.
In general, it's true. Darker skinned people tend to have more keloids, and we see a lot of them on Guam. There's not a lot you can do about that except to know that you're a keloid former. It's a genetic thing. It's the way your body does its own healing. So you're more prone to it. Be aware. If you get a small cut, take care of it. Don't allow it to get infected, and really just avoid injuries.
Okay. Larry from Molessu writes, I've had a scar for the last 18 months and it seems like it's getting bigger and darker. Should I be worried?
Yes, it sounds like it's developing into a keloid, and keloids can be treated effectively. If you do notice that, it's been a year, my scar's still growing, it's itchy, it's maybe tender or painful, then you can be seen and have that scar injected with some steroid medicine, because that whole wound healing thing is a function of your immune system. And when we put a little bit of steroid medicine right into that scar, we interrupt the over-healing that the immune system is doing, and we allow it to settle down. Usually several injections are required. I usually do the monthly, do one, come back in a month, come back in a month, several times, and by doing that we can shrink down that scar and allow that keloid to stop growing.
Okay. Marie from Manila asks, I've seen advertisements for scar removal creams. Are they bogus or do they really work?
Well, that's a tough one. I think scar removal is incorrect. Once you have a scar, you have a scar. Maybe improving the appearance of it, possibly. Most of the creams don't work very well, truthfully.
Okay, yeah. Good to know. Sally from Tumon asks, I don't want my child having scars all over her legs. Is there anything I can do to prevent scars when she gets cuts and scrapes?
Yes, we can see this a lot on Guam. First, try to help your child. Wear long pants if you're running around outside. Don't let the child run around and get ant bites all over their feet and legs and mosquito bites. Put some off on their clothing or even on their skin. Or we were talking Avon Skin So Soft has some citronella. You can use that to prevent the insect bites. And then if your child does get some insect bites, cut their fingernails so that they're not digging and creating worse injury to themselves. Keep their hands clean so that it doesn't get infected. And you could put a little antibiotic ointment on the itchy areas so that the child again doesn't get an infection. But most of all, if you moisturize, keep the sunscreen on, and prevent infection, you'll have the best outcome you can have.
Okay, Vincent from Barragata asks, when my son scrapes his knee, is it best to let it air dry out to let it heal?
Yes, great question. After the scraped knee, wash it with soap and water. Again, avoid the peroxide. Soap and water, put a little Band-Aid on that during the day, because we don't want germs getting in and causing an infection. At nighttime though, when your child's resting in bed, you can take the Band-Aid off and allow that wound to breathe and to air dry, and that will help with formation of a nice scab, which is part of the healing process. But during the day, again, put the Band-Aid back on so that your child doesn't get an infection.
Okay. And Malia from Santa Rita asks, will aloe vera reduce my chances of scarring?
Aloe vera does actually help. You can break the aloe vera plant and use a little bit of the gel, fresh gel, right on the wound. It does help a little bit to speed up healing, and it seems to help minimize scars. So that is one natural thing that does help.
Okay, any other advice for people out there who've got scars and wounds? I was going to ask you about stretch marks. Are they a form of a scar?
In a way, they are. They are an injury to the skin. What's happened there is that we have two forces. We have collagen, which is a sort of a tightening fiber in the skin, and we have elastin, which is a stretching fiber. And in some people, just like some rubber bands, they're more stretchy than others. Some rubber bands you stretch and they're kind of tight, and people that get stretch marks, especially from pregnancy, have tighter skin. So stretch marks, there's not a lot you can do about them truthfully except to moisturize and give them time. If they're very red, we can use laser to minimize them, but if they're that silvery color or a dark color, really nothing much will help them, and it's really a waste of your money to spend a lot on creams. Again, give them a full year before you decide with your stretch marks you want to do something about them. And typically the best thing for stretch marks, especially on the tummy if it's after pregnancy, is actually plastic surgery.
Just so a bunch of gimmicks with the creams.
Yeah, it really is.
Good to know. And no hydrogen peroxide.
No hydrogen peroxide.
All right, Doc, any other last words of advice for our viewers out there?
Scar prevention is the best way to have less scarring. And so take care of your wounds, try to minimize your wounds. And if you do have an injury, especially if it looks like it's getting infected, please get treated so that your end result will be a nice one.
All right, Doc, thanks again for coming in.
You're most welcome.
Dr. Lom will be back again next week when we're talking body aches, sprains, strains, and muscle aches. Send us your questions to healthyliving@kwam.com or post your question on our Facebook page or on our website. There is more healthy living still to come. Stay with us.